Morning, everyone. Well, so when Christina asked me to do this, I think I was asleep. And so I'm really happy to be here, but not sure what to say. I'll start by saying I am not an expert in equity, diversity, and inclusion. I put together this deck really to speak to a group of pharmacists who were going to be coming together, and one of my staff had seen a blog that I had written, and the blog was about diversity, equity, and inclusion, and he asked me to put together a deck, which I proceeded to do a little bit of research, and this is what I'm going to share with you today. I'm not going to read our WRHA land acknowledgement. In 2023, we went through a process of developing a new land acknowledgement with the support of our board of directors and really engaging with several Indigenous folks. Part of the reading of the land acknowledgement, so that it just doesn't become a superficial process, is to share a personal reflection. And so I'm not going to share the personal reflection right now. I'll share it a little bit later in the slide, but wanted to share that with you. So next slide. And we'll go to the next slide. So what we're really going to do today is I'm going to highlight the critical role of diversity, equity, and inclusion in healthcare and why it is so important. And I'll share with you some stories and how I got to the place of really looking to invest more resources into ensuring that we're focusing on diversity, equity, and inclusion. So why does it matter? Well, how this all began and how it all started, I wrote a blog one day, and I talked about how excited I was because we had a group of individuals from the Winnipeg Health region who were going to walk in the Pride Parade. And so my blogs usually go out to our 14,000 employees, and I got lots of responses back from people saying, thank you so much for acknowledging this, thank you for encouraging people to walk in the Pride Parade. And then I got responses back from people saying, what do we have to be proud of? Why are we celebrating this? And on one hand, I thought, wow, it's great that somebody would feel comfortable enough to write me to say that. On the other hand, I thought, wow, how brazen that somebody would feel comfortable to write me that. And so, I chalked it up and I wrote another blog just talking about the response that I had received. And then another day, I was surfing on Reddit, and there's a little blog, no, let's go back, yeah, there's a little write-up there, and this is about an individual who has a little bit of an accent. And he or she writes, I called the family doctor finder number today because I was looking for a doctor for a minor family member. The representative I was talking to was not very clear with some of his words, so I had trouble understanding him. I just asked him if he could repeat some of the things he said. In return, he said that my name looked funny and that he couldn't understand me either because my accent is a problem, and impersonated me speaking gibberish. And so then you can imagine the write-up that came about. And no, you're going too fast. So I'll just say next, and then we can go into it. And so we did a little bit of write-up. And then some of you will remember when the AMC Grand Chief Kathy Merrick passed away. I was at the hospital when she passed away because we had a large crowd that was gathering outside of the hospital. And she had passed, lots of family had come to visit. And I was speaking to one of the chiefs, and he said, I need to talk to you about something. And I said, well, what is it? And he said, there were some paramedics talking about Grand Chief, and they were saying some pretty derogatory things. And he shared with me some of the things that had been shared. And so in an era where you would think this kind of stuff doesn't happen, it's still happening. It's happening more brazenly, and we've got to address it. So now we can go to the next slide. So this is where I'm going to give you a little bit of personal reflection. So you look at these photos and you see a young man with lots of hair. Oh, I wish I was that young man once. So every one of those photos is a photo of me. And so Christina introduced me as Mounir. Mounir is my given name. I was born in Lebanon. And we lived in Lebanon till I was about 4 or 5 years old. And we had to leave Lebanon because of the war that started in 1975. I've really benefited. And so in the top right corner, that's me, Mike Nader, when I became Mike Nader, on my first day at work at Vancouver General Hospital, working as an IT tech. So that was 34 years ago. And how I became Mike was because people couldn't pronounce Mounir. I don't know, I think Mounir is pretty easy to understand. Think of the moon, think of your ear, Mounir. But back in the 1990s, that was a very unusual name. Christina and I have a friend. I won't say his name, but I'll tell you a little story. He moved to Toronto, and he was looking for a job. And he was putting out his resume, and he wasn't getting any interviews. Very skilled at what he does. So he decided he was going to change his name to Nathan Matthews. All of a sudden, he was getting job interviews and opportunities, and things were opening up. We have work to do as a society. Let's go to the next slide. So, what is DEI? What is diversity, equity, and inclusion? Diversity is encompassing and embracing the differences that we have in race, ethnicity, gender, language, socioeconomic status, and really because it reflects who we are as Canadians. We have a multicultural society. Every one of us who lives in Canada is an immigrant to Canada, except the Indigenous peoples. They were here. We all came from somewhere else. We're all immigrants to Canada. Equity is about ensuring that all patients, regardless of background, have fair access to high-quality care. And inclusion talks about creating an environment where patients and healthcare workers can feel a safe place to deliver care and to receive it. Now, why is it important that we have all three? Because if you have an organization that is just focused on inclusion and diversity, you get a situation where the diverse group or the diverse the ideologies, they're the ones that get deferred to for the decision making. If you have equity and diversity, you get cultural assimilation, resulting in disengagement, low morale. And if you have equity and inclusion, you get an oversaturation of similarity. You get a homogeny. So what you want is you want all three, and what it creates is belonging. And that's what we're trying to create in the healthcare system. So the next slide, I'm going to walk you through why it's important. And I'm going to talk about the moral argument. I'm going to give you a business, for those of you who are any finance people in the audience? For those who are finance focused, I'm going to give you the business case for it. And I'm going to talk about the societal impact of diversity, equity, and inclusion in healthcare. So the next slide, the moral argument. It's ethical. It aligns with the principles of justice and fairness. It ensures that patients can receive optimal health care, and we can deliver on the key objectives of Canada's health equity strategy. Christina talked beautifully about that in terms of what Tommy Douglas was trying to create. And, you know, it's a fundamental universal right. Right? Being healthy and well, that's what we all want. Next slide. So this is a slab of, next slide. Nope. We're missing a slide. There we go, thank you. How could we get rid of the business case slide? I mean, really, that's like the most important slide to somebody who worries about numbers. So what's the business case for diversity, equity, and inclusion? One of the biggest challenges, for those of you who are wondering what's the biggest challenge in healthcare today, you want to know the secret? It's we don't have enough people. It's not about money. We don't have enough people. Many of the people who delivered healthcare during the pandemic got so burnt out that they en masse retired or they en masse quit. That's our biggest challenge. And so when you create an organization that's focused on equity and inclusion and embraces diversity, you have a broader talent pool, you have increased employee satisfaction, you have increased retention. When you have a diverse workforce, you can find savings, you can find efficiencies in the healthcare system. You can get better clinical outcomes because the people who are providing the care represent the people who are coming in the door. Next slide. So, what's the societal impact of diversity, equity, and inclusion? Cohesion. Cohesion in our society. We don't have cohesion right now. I look to the south with our good friend down there, and we're going to have 4 years of not cohesion. We're going to have polarization. Whether you like his policies or not, we know we're going to get polarization. By focusing on this, we will reduce health inequities in the system. And I'll talk a little bit later on about some of the health inequities that exist. And when we embrace diversity, we strengthen the healthcare's ability to serve everyone. I'll share some stories as we move on. So some of the challenges with the next slide, some of the challenges in diversity, equity, inclusion in healthcare I'll share. We'll go in through each of these individually, but unconscious bias. So this is where people unconsciously have a bias towards who is coming in and presenting. Some of the structural inequities that we have in society, but also within our healthcare system, and then a little bit of the resistance to change. And you heard me tell you a little bit about the story of the staff member who wrote me and said, "What do we have to be proud of with the Pride Parade?" They went on to say, I forgot to mention this part, they went on to say, "I feel really bad for these folks. They have a mental disorder. We should help treating them." Next slide. Let's talk about unconscious bias. So how many of you, when you go to the hospital, dress up, wondering why I'm wearing a suit? How many of you dress up to go to the hospital? A little bit, maybe. Put on your Sunday best. When we talk to Indigenous people, every time they go to the hospital, they dress up. And the reason is because they don't want to be treated differently. There was a story that was shared with me. And you know, in my job, I get to hear all the stories, whether they're good or bad. And so we had an individual who was a roofer. And so this story resonated with me because, and Christina will attest to this, on Saturdays and Sundays, I like to put on my dirtiest jeans, my grubbiest shirt, and I'll go out and I'll be picking grapes and whatever, and hands are dirty and scruffy, and I get dirt and stuff on me. And I imagine if I fell off that ladder and I showed up in the hospital dressed in my dirty clothes and everything, what do you think folks are going to be thinking? That unconscious bias that we have sometimes in the healthcare system. Oh, he's maybe drug seeking. So we had an individual, and I should preface all of my stories. Some of them are here from Winnipeg, some of them are from Toronto, some of them are from Vancouver, so they're not all from here in Manitoba, so don't feel bad. But we had one individual who was a roofer who fell off the roof. And if any of you know, roofing is a pretty dirty job. You get tar on you, your hands are crusty and everything. And he fell off the roof and he was in a lot of pain. He showed up at one of the emergency departments. And staff were thinking he was drug seeking. And it turned out that this individual's mom was a nurse. And so he called and said, "Mom, they're not taking care of me. Like, they've kept me in the hallway and they're not doing anything with me." And so she showed up to the emergency room and she advocated for her son. I said, "What are you talking about? He's a roofer. He fell off the roof. He's in pain. Have you checked him out?" And they did. And they discovered he had a pretty serious fracture. So for me, when I think of unconscious bias, I think, of care providers who are all very well-meaning. but who, over the years and years of caring for people, start to see things that present, and they start to make stereotypes. We have to break the unconscious bias. We have to look at training our staff. We have to be able to share those things, and we have to encourage our staff when they are in their busiest time, when they are stressed out as much as they are, to look at that person who's in front of them and imagine that's their father, their mother, their brother, their sister. Next slide really talks about some of the structural inequalities in the healthcare system. If you're homeless, who's your family doc? Maybe you're lucky, maybe you might be attached to a primary care clinic that's out there. But if you're homeless, more often than not, you won't have a primary care physician who's following you, who understands you, who knows all of your care needs. If you live in rural Manitoba, you may not have access to fresh fruits and vegetables. You know, when I fly up to Churchill, how many folks know Churchill's part of the Winnipeg Health Region? Yeah, okay, it's kind of cool. I love it. I get to do a little bit of rural. But when I go up to Churchill and I say, what would you like me to bring? You know what they ask? Well, so Tim Hortons, okay, that's Garen, it's like, of course. And then bring some fresh fruits and vegetables. Because you go up to Churchill and an apple is like $6. So you go into the rural communities, they're not getting those fresh fruits and vegetables. They may not have access to the physicians, the primary care physicians. They definitely won't have access to the specialists. And so there are those structural inequalities that by virtue of the size of Canada that we have, they will exist for us. And so we have to look, and this is where policy comes in, we have to look at policy changes to enable supports for individuals who live outside of the large urban settings. Next slide really talks about, you know, how many people like change? I like change. But that's because I'm the guy in the corner saying, I don't want to change, I want all of you to change. Change is easy when you are driving the change. When you are having something changed upon you, it's not so fun. And so there's a lot of fear in change. There's a lot of discomfort. There's a lot of uncertainty. And so when we talk about inclusion and equity, a lot of people start to question, what the heck are you talking about? These people who are out on the streets, let them go and find a job. They don't understand. They don't understand the history, the trauma that some of these individuals have faced. I see it every day. Our offices, our head offices are at 650 Main. Right across the street is Main Street Project. I see it every day. And thank you to all of you for pulling together the socks and the toques, because I can't tell you how many people I see walking barefoot in the snow with maybe a blanket wrapped around them. Next slide. So some of the strategies to promote DEI in healthcare that we will employ. Education and training, we'll focus on policies, and we'll focus on leadership, making sure that the leaders are constantly driving that message home. Next slide. So in terms of education, it's so important, right? Like I think back even 10 years ago, I wouldn't have known half of the things I know about the experience that Indigenous peoples have experienced here in Canada. That's just 10 years ago. We have within the Winnipeg Health Region, we've just partnered with Omgamazin at the University of Manitoba, and we've developed a Manitoba-specific Indigenous cultural safety training program that we're going to require every one of our staff in the Winnipeg Health Region and across the province to take. It's a great program. I don't know yet. I haven't taken it, but I've taken the precursor to it, which was it used to be called the Manitoba Indigenous Cultural Safety Training Program, and it was sponsored out of British Columbia. So education is really important, of course, but we also have to make sure that people embrace that education and then they live it. Because how often do you go off on a course, you take the course and you go, well, that was good. And then you go back to your job and you just go back into the role. So continuous training, continuous focus, reminding people and encouraging people when they see something or they hear something to stand up. How many of you have watched that show? I think it's 2020 or something, where they kind of do that hidden camera thing where they'll have somebody and they'll abuse somebody and they'll wait to see if anybody stands up and speaks. And more often than not, a lot of people just watch and don't actually say anything. It's important to speak up. When we talk about policies and practice, ensuring that we have inclusive policies, that we encourage encourage proactive work, discourage policies and structures in place that fundamentally discriminate against people. So we're looking at, when we think about Indigenous peoples who are working within our healthcare system, a lot of times for our entry-level jobs, it says you need a high school diploma. Well, a lot of times Indigenous peoples haven't received their high school diploma. And so how do we encourage, how do we open up that opportunity? I'll share another story that I had. I had a young man come to me, this was maybe 15 years ago, and he was from Kenya, and he just moved to Canada. And he had his MBA, he got his MBA from Lancaster University in the UK. And he said to me, I'm trying to get a job here, Mike, and nobody's going to hire me. Nobody's hiring me. Nobody will, every time I talk to them, they say, well, you don't have Canadian work experience. He said, what advice would you give me? So I gave him some advice. Clearly it wasn't very good, because in 6 months he came back and he said, Mike, I'm still nothing. He said, I've got a proposal for you. I'll work for you for free for 6 months. Just so I can get that Canadian work experience. You get free labor, and I'll do it, and I'll get that Canadian work experience. And I said to him, no, I can't do that. Our policies don't allow it. But what we did allow is we allowed for internships. And so here's a man who'd done his MBA, 10, 15 years prior, had been a director in his own home country. Brilliant young man. And so I'm hiring him as an intern. So we hired him as an intern for 6 months. And guess what? He was brilliant. He had no healthcare experience, but he came in and he helped us deliver on a whole bunch of different projects. He's now an executive director at Vancouver Coastal Health. When people ask me what are some of my proudest moments, those are some of my proudest moments. So the next slide really talks about the importance of leaders and the role of leaders in promoting diversity, equity, and inclusion. And so how do you go through a process like that one individual who wrote me about the Pride Parade? How do I talk to that person in a way that is not destructive to them, not slamming them down, but also trying to educate them and help them understand? Because if we can build those folks up who really are uneducated in regards to what we're talking about, we can really, really improve the system. And there's lots of organizations that are trying to drive diversity, equity, and inclusion in the healthcare system. Accreditation Canada is one. This is the body that accredits every healthcare organization in the country. I'm a surveyor with them, so I get to go around the country and actually see what other health organizations are doing. And so it's wonderful when they are trying to promote that inclusive culture through the standards that they develop. And so they'll start off slow. They'll say, okay, this is a standard, right? An anti-racism policy, that's just the standard. The next thing you know, after a couple of years, that standard becomes a high priority criteria. High priority criteria are more important than the regular standards. And then after a couple of years, they become what's called required organizational practices. You don't meet your required organizational practices, you don't get accredited. So that's how Accreditation Canada has managed to improve the bar, raise the bar in quality. So next slide, some of the success stories. There have been lots of really great organizations across the country who have tried to embrace different initiatives around DEI. Toronto Western Hospital, where I used to work, is in the heart of this multicultural community called Kensington. And so they embraced patient and family council, where that patient and family council will come in and they'll talk to them about how they can provide better health care to that community. When I was at the Richmond Hospital in Vancouver, at Vancouver Coastal Health, and we were looking at our signage, our senior executive team got into a debate. Well, what language should we have with our signage? And so I had half of the senior team who said, well, clearly, French and English. Those are our two official languages in Canada. Well, how many people speak French in Richmond? Okay, I should be careful. I get myself in trouble. But the predominant language there is Chinese, it's Mandarin. And so half the group said, well, we should have some in the Chinese language. No, English, French. No, Chinese. We landed with Chinese, but only because it was like 4-4 and I was the vote. And the reason I went down that path was I'd been down in the US in San Diego. And I don't know why I'd visited a hospital down there, but I visited the hospital, and when I got down there, their signs were in English and Spanish. Well, Spanish isn't an official language in the US. I mean, it's maybe an unofficial language. But why did they do that? They did it because people could find where they needed to get their healthcare services. Staff were not being interrupted saying, can you tell me how to get to diagnostic imaging? And somebody talking to them in Spanish, and they're having to find somebody who's Spanish to be able to talk to them. We remove the barriers to the healthcare system. So, if I talk a little bit about the next, work that we're doing within the Winnipeg Health region around DEI, we look at our representation in our leadership team. So 70-80% of the workforce in healthcare is women. 70 to 80% of my leadership team are women. We just recently hired a chief operating officer for Indigenous health. We didn't have a person on the executive team focusing on Indigenous peoples. We have a very large population of Indigenous peoples here in Manitoba. 40% of the people who present to a hospital are Indigenous, either First Nations, Inuit, or Métis. And so how do we reflect their needs and what they require? We've established a leadership development program where we're supporting young people to become better leaders in the healthcare system. Our strategic plan, which we developed in 2023, we have 4 pillars: our care, our system, our team, for all. For all is focused on equity and inclusion. And if you're interested, you can go onto our website. You can see what we've done in the last year and what we're going to be continuing to do in that. And then at the provincial level, we have a Disrupting Racism initiative. So looking at establishing policies and practices around racism within the healthcare system. So, next slide. Remember I'd spoken about this was a presentation that I was giving to healthcare professionals. And this slide, I call it the call to action. This call to action is totally relevant to everyone sitting around this room and who's on the screen today, because it's so important that you empower yourselves in your healthcare journey. Right? A lot of times when people present into the healthcare system, you feel like there's a power imbalance. I'll share another really good story. Well, it turned out good. So I was sitting when I was in Toronto with one of our healthcare leaders, physician, who worked in the laboratory. And we're sitting in a meeting, and all of a sudden he's like grabbing his chest and he's saying, I'm not feeling very good. And so I said, well, let's take you down to the emergency room. And it's a good thing we took him down to the emergency room because he was having a heart attack. And he ended up getting 3 stents put in. And worked out okay. Survived, everything was good. But I went up to visit him up on the inpatient unit. And how many of you have been in hospital and they make you put on that robe? Right? I call it a mini skirt on me because it's really quite short. And so I'm sitting in his room chatting with him, and a nurse comes in. Nurse comes rushing in, does some stuff to him, and goes rushing out. And I'm watching and I'm thinking, and I said to this doc, I said, hey, she didn't wash her hands. She didn't wash her hands on the way in. She didn't wash her hands on the way out. And this person was responsible for hand hygiene in our hospital. And I said, why didn't you say anything? He said to me, he said, Mike, I'm wearing this miniskirt. Like, and he's a healthcare leader, a doctor. And he felt reluctant to actually speak up. So if there's nothing I leave you with today, you need to advocate for yourselves. You need to advocate for your family members. It's very important because there's only one person who cares about your health uniformly, 100%. That's you. And maybe your family members. And as much as the doctors and nurses care and want to deliver the best health care possible, they will truly not care about your health as much as you do. And so it's important for you to advocate. It's important for you to speak up. If something doesn't seem right, ask them. We deliver 450,000 home care visits a month. Even if we have a 0.0001 failure rate, that's still a lot of people. So it's really important for you to advocate for yourselves. My last slide. So Jesse Jackson talked about inclusion. It's not about political correctness. It's about growth. It's about love. It's about embracing people. It's about equity. It's about inclusion. And it's about embracing diversity that we have within Canada. Thank you very much.